All right, first video on YouTube. I've been really pushing this off, but also really looking forward to starting this channel. Right now, I'm just doing a little bit of a cool down, some steady state cardio after my workout, which will be right after this little clip. I'll do a little intro, very brief, and I'll talk about the workout that you're about to see, and let me know how you like that format. Because basically I just recorded myself doing the majority of the workout, and I think I'll do a voiceover, just talking a little bit about the movements. But anyway, my name's Peter. I'm a physiotherapist, and I work with athletes at all levels, variety of sports, but my passion's working with soccer players and karate athletes, basically things I grew up competing in. So I practice at two places. I'm in this facility on Saturdays. It's honestly, I'm a little bit biased, but probably one of the nicest clinics as far as gym space goes in the area. So if you're in the South Etobicoke area or anywhere in the GTA, I highly recommend checking out Humana Health. And I work full-time out of a clinic also in Etobicoke, New Age Physio. So I just wanted an outlet where I could post some longer format videos. I'm pretty active on Instagram. Some of you may have followed me on to hear from there. But with this channel, what I intend to do is post a lot of my training. It's going to be a variety of things. Could be some hypertrophy, bodybuilding style training. Some of it could be very soccer specific, and everything between, some conditioning. As a physio, I'll try to offer some rehab insight. So if you're going through injury, I myself am going through a groin injury, so you're gonna see some of that in the leg days. But yeah, feel free to jump in with me on that rehab journey, or if you're going through your own fitness journeys, feel free to chime in. I'd love to hear about what you guys are working on and working towards. What else can I say? So I also had the intention of posting some longer format videos of me just sort of talking about certain topics, like the current injury frequency in pro soccer, and different specific injuries or conditions. Might go over new research, so look out for those. That'll be like a separate series. What else can I say about my practice? Like I do use a lot of manual therapy and exercise. Those two things make up the majority of my practice, especially when I'm working with you here one-on-one. And I'm taking ongoing training towards the orthopedic and manual designation that's in Canada. It's like a fellowship for manipulative physiotherapy. So a lot of exercise, a lot of hands-on work. And I might bring the camera into the other clinic and you guys can see some of the actual techniques I do. We'll see if any clients are interested in, being a part of that. And yeah, you'll notice, like, when I get into some soccer chit chat, I'm a bit of a Chelsea fan, so you'll see me kind of talk about maybe some of that, or you might have noticed on Instagram some of my videos are featuring Chelsea players. But I don't want to keep on blabbing. I'm going to do my steady state cardio about 20 minutes now, and this is at the end of my workout. So stay tuned and enjoy that workout. It's going to be leg focused, a little bit more catered to soccer players, but very functional, very useful for any sort of athlete. And it'll have a good portion of it will actually be focused on groin rehab exercises. But even if you're not dealing with an injury, those exercises are going to be great to help reduce the risk of injury. So enjoy. So just bringing the kettlebell over, and the first movement here of this lower body workout, it's more of a full body movement to start with, but the focus you'll see is more of a lower body focus. So first movement is a clean and press, and I'm going to start with what do we have here? I think about 30 pounds. And you'll notice I usually start slow with these, relatively slow. I realize I set this camera up not in the best position. My head goes a little bit out of frame at the top of the movement. But regardless of how slow you start, you want to slowly pick it up, because the main purpose behind this movement is to work on power. So you're actually trying to explode out of the bottom there. Great first movement to really get the blood flowing. I also like to start or put the compound movements in the beginning of the workout, as opposed to starting with like an isolation type of exercise. I like to leave those for the end. In terms of other specifics here, like I'm trying to keep the rest relatively low. You'll find this workout's pretty compact. I don't think this this video goes longer than about 20 minutes or so. So that's pretty short for a workout. Obviously, there are parts of the workout that weren't really included in this, and you'll see some bits at the end where I just get into some band work and stuff. So again, really trying to pop out of the bottom there and keep the kettlebell going up smoothly. I'm actually not as good on the left side here. I don't know if you guys end up trying something like this. You might have a better side. So hit each side and then basically let the heart rate come down. You're not waiting for full recovery, but at least getting back to, if your max is somewhere around 170, 180, or 190, let it come down to maybe 130. So a good amount of recovery. And yeah, if you don't have a heart rate monitor, that's fine too. You can always just kind of see how exerted you are. You could do the talk test. If you're able to kind of keep a conversation going, you're probably ready to go into the next set. And that's obviously with this goal of conditioning in mind. It's a little bit different when you're trying to get really strong and lift heavy. You might need longer rests. So I've got this old Alpha Elite shirt. Took it out of the closet just for this video. Let's hope they sponsor me one day. And right into the next set. This workout's really catered to soccer players for a few different reasons. This is the type of movement that I like to do with these athletes because it builds speed and change of pace. You're coming out of the pocket there using your legs and hips, so that whole complex there is working. Very functional for a lot of athletes, very useful. It's a movement that's a little bit tricky to teach, I find, the younger kids. Like usually at the younger ages, we just try to really master the basics, like the squat first. But once those are really refined and ingrained, and it just comes naturally to them, then you just add speed. It's way easier. You don't want to start with this. So if you haven't really gotten someone to look at your squat and clean that up, you may not be right in a position to start this. I just have some electrolytes in there, BioSteel, nothing fancy, and some creatine. I probably should have done a few more of these in the beginning, right after the warm-up. My warm-up was just on the stationary bike. It's a little too similar to that intro clip that you saw as my cool down, so I just didn't throw it in. But I really, really recommend some of these more dynamic movements as a warm-up.
And if it was like a different type of workout or maybe heavier squats, I'd probably emphasize a bigger dynamic warm up. This is really something that I felt like I could kind of use as a warm up in itself in that first set. So just changing it up into a kettlebell swing, and instead of doing the same arm really tiring out one shoulder, I just kind of hit shoulders not too long ago before this, so it just feels easier switching hands at the top. You might not be able to if the weight's a little too heavy for you. You don't feel like you're in control, but once you get the rhythm going and you're okay with the weight, you can just keep alternating hands and try and get like at least 20, 30 seconds in with this. This kind of mimics a little bit of a sprint action. Again, if we're trying to correlate it or translate it back to soccer, trying to keep things a little bit relevant. This is where you start feeling that burn. You can kind of see my face. And the heart rate should really be up high with this movement. Doesn't take long. You'd be surprised. The burn really kicks in about 20 seconds in. Okay, you can do two hands, of course, if you want, but this was a light enough movement. Again, great with just learning how to control your body, working with momentum, and building some power. But there's that conditioning component too. Letting that heart rate calm down again. This is the first video on the channel, of course, so just to make it easy, I've sort of set up the whole workout in this frame for the most part. I'll use the box there for some jumps, and next we'll just get right into the adductors. So I might have mentioned in the intro clip, but basically I've been working with this groin injury for a little while now, and it's nice to finally be able to tolerate the Copenhagen plank. This is just the easier version on your knees to get you going as a little bit of a warm up, or if you're a little earlier on in your rehab, you can start with these. And really, truthfully, I wasn't even able to do these in the beginning, so it took a little while to get to this point. There are much easier exercises than the Copenhagen plank if you've sustained a groin injury relatively recently, or if it's pretty severe. But hopefully you can get to a point where you can start with the knee version. The one that I'm doing right now is a warm-up, and then slowly pull away from the bench or the platform, whatever you're using. Because the standard would be actually kind of at your ankle and inner foot. So now I have to admit, I haven't been doing both sides for most of the rehab. So this is maybe the first session that I've started to include my left leg. I think there's a lot of benefit in this sort of isometric adductor position where you're not really like moving, but you're loading it with a good amount of weight, your body weight, really. There's a good role for that, I think, for injury prevention. So notice that I'm not really resting too much. I'm actually just using the other side as like a superset, and we're gonna basically get right into the slightly more difficult version of the knee variation. So now I'm kind of mid part of the lower leg. Again, each of these progressions, like going from the knees to the mid leg and then eventually to the ankle, probably took like at least a couple weeks maybe to progress to. So these things are really slow. If you do a bit of reading with these groin injuries, you'll find that, I mean, in best case scenario, the actual muscle belly gets injured. So your pain might be like in the middle of the inner thigh, and the injury is in the actual muscle belly. So that basically means it's got a better blood supply and it heals faster. In most cases, those are a little bit easier to recover from, unless there is really significant fiber damage, fiber tearing. then you're really dealing with muscle injury, like any other serious muscle injury. But the ones that I find take really long and it looks like something I've sustained is more proximal, more towards the tendon where it originates near the pubic bone. And so in terms of like just self-diagnosis of either confirmed or realized that I'm probably dealing with a really bad tendinopathy where the tendon is just didn't heal properly in the beginning stages. It's sort of playing through it like a lot of players do. Or something more at the actual insertion point, get an endosopathy maybe. Those are probably even worse in terms of timeline. So whether it's a tendon or the insertion, you just got to be really patient with these and slowly progress the exercises. Things that help could be shockwave therapy, manual therapy, dry needling, or acupuncture. There's a variety of tools. I'm just going to speed up the video a little bit for the rest of these Copenhagen's. Nothing really different to watch as I keep talking. I can go over some more details with these groin injuries, but the movement's basically the same. So I'm just kind of resting here for a little bit and jumping into the slightly further Copenhagen position. Now for me, the next step would be just to add a little bit of movement, and you might catch me occasionally sort of dipping down a little bit and then propping back up. Adding a little bit more of a concentric, eccentric component and stepping away from the isometric loading. But if you ever like stumble onto Jill Cook and her work on tendon injuries, a lot of that is kind of focused on the patellar tendon and the Achilles. You'll see there's a lot of room, especially in the beginning, for loading a tendon isometrically or slowly and very heavy, as much load as you can sort of tolerate with exception, of course, and with guidance of a physio, and doing that to build the tendon before you really get into more dynamic or plyometric sort of exercises. All right, I'm sort of dipping down a little bit onto my left hip. There's not a lot of range I'm working with here. With this bench, you might want to have a slightly higher platform. Oh, and I actually was moving closer on my left side, which is not my injury side, just because the inner knee was starting to not really like that stress on it. And I don't need to bore you guys with my injury history, but it was actually the opposite leg, so my left leg. That's not really injured right now, but that's the one that had 3 knee surgeries. So I've actually had a bit of poor luck through my soccer career and karate career, if you want to call it that. 2 ACL reconstructions and 1 partial meniscectomy. So the left knee is actually, considering what I've been through in the last few years, just because I've been really, really diligent with the exercise piece of the rehab, especially after the most recent surgery. The knee's been pretty good. I've had other issues actually, little sprains, my ankles, and these like pulled muscles here, but that's just me sort of playing soccer irresponsibly. All right, so anyway, enough about me. Let's go into this workout so you guys get an idea of what else to do in the gym if you've got soccer on your on your focus. So you'll see I just finished up the first set of box jumps. Another pretty simple, I actually find some of the best experts in the field, some of my mentors, they're not really the ones that you see in the clinic having someone stand on like a Bosu ball using like 2 different therabands and throwing a ball or like doing something ridiculous. Like sometimes simple is better. And I can go into, some of the reasoning behind it. But basically just a standard box jump, starting to build that capacity to absorb weight and load quicker. There's also a nice conditioning component to this. I usually get through 10 pretty well, but I've sort of lost some fitness over the years and start feeling that fatigue set in at like even 5 or 6. So I'm going to keep this speed going. I think this is fine. It's just 2 times the original. And then I'll slow it back down to the original speed for the next batch of exercises. I have sliders coming up after this for the groin injury, and you'll see some band work. And the band is pretty fun, actually. That's like my favorite part of the routine, to be honest, as far as rehab goes, because it really feels like I'm kicking a ball when I get the band going. So 3 sets of box jumps. You could do more, or you could push yourself a little bit closer to failure with more repetitions. You can have some fun with the box jumps, but I'm moving into the sliders here. Notice how I'm going into quite a bit of hip extension. That leg is coming back quite a bit. I find I don't have too much of an issue with the leg going directly out to the side. So there's that hip flexor component or anterior adductor component to my injury, I guess. And, I'm sort of just chasing that slightly difficult feeling, but staying within a relatively comfortable zone. Like I keep the pain with these below 2 or 3 out of 10. It's actually hard work on the leg that you're balancing on. So my left leg's really feeling this because I'm not putting too much weight through the right leg going through the slider, especially at the end range position. So those are the sliders, and now you're going to see me set up this band, and I'll just slow down the video a little bit. You can see now I've got a few different components of a rehab program going. I started with some isometric, heavy loading with the Copenhagens. Then we moved into some eccentric controlled movements like the sliders. And now you'll see here that there's going to be a little bit more of a, well, first of all, sport specific component here, because I'll be mimicking short passes and shots with the leg. Still working with some resistance because I'm trying to really stimulate the healing process with the loading. The worst thing you can do for tendons, as per Jill Cook's work, is rest it. You really don't want to rest the tendon too much. Once you're maybe in the acute stages, sort of a day or two out, then really we recommend usually to start some sort of movement and activity. So going into just regular hip flexion, trying to really control it on the way back too, not letting the band just flop my leg back. And here we're going across the body with the leg. Now I actually find, and I don't know if any of you have gone through this groin injury before, this type of groin injury in a soccer context, but I actually find passing the ball with you sort of squared facing the direction of the pass with your body, but your leg rotated out to the side with external rotation, you just pass the ball in front of you. That's actually easier than if you were, for whatever reason, not facing the person you're passing to, and you're trying to drive that ball across your body with that hip horizontal adduction. That for me is a little bit less comfortable. I don't know if it has to do with closing down the hip joint more, whereas when I externally rotate my hip and pass in front of me, it's just a little bit easier. The hip joint's more opened up. So that's interesting. And again, I'm sort of chasing the more difficult movement with my rehab, and that's something you generally want to do in physio. We get really good at finding weak points and finding ways to pursue that. You're going to see some more interesting things with the band here. Once I've ran through these repetitions, I'm actually going to try some side shuffling. And there's a point to the band here. Basically, not too hard actually driving away from the band where it's pulling. But once that leg is lifted off the ground, that band is going to want to abduct or pull your leg out to the side. And then in a very quick and rhythmic sort of way, as you're side shuffling, you're fighting that resistance. So it's really, really applicable. A lot of fun. You can throw in some ball work and pass work with this. All right, that's it for that video. Hopefully you guys enjoyed it, and stay tuned for more content.